Well, good morning. Good morning. Welcome to Geek is Chic. Never thought I'd be a geek, but here we are. Our presentation is about communicating and promoting technology in a changing healthcare world. My name is Pat Mead. I'm the director of the PMO at Barnes-Jewish Hospital in St. Louis. And Valerie Hoban, who will be doing most of the presentation today, is our coordinator of marketing and public relations at the hospital as well. And I hired Valerie, and I'll kind of tell you a little bit of the story. So this morning I'm just going to give you a little bit of history on Barnes-Jewish Hospital, how we got into the technology geek world. On your seat you have the Geek Speak bags that we use and a geek pair that we put together. I'll explain a little bit about the program management offices to introduce how Valerie came into my life and introduce us to the geek world. And then talk a little bit about, Valerie will go into communications support, so the marketing, communications, and then have a discussion and kind of show and tell. You can come up and look at our table display and things that we've done in promoting our IT technology at Barnes-Jewish Hospital. So some of the key takeaways, we want to talk about some of the marketing successes, what worked, but then also spend a little bit of time on Even Better Is. We're very much a lean transformation program at Barnes-Jewish Hospital, and we call it the Even Better Is, opportunities for things that didn't work so well and what we can do to make it better. There are some examples that you have in your Geek Speak bag, and those are yours to have. And there's some other opportunities as well as Val's card that you can learn more about some of the things that we've put together to try to explain and market some of the activities that go on in the hospital. And then just IT in general is growing in healthcare as we get into the reform, and I'll explain a little bit about that. So at a glance, Barnes-Jewish Hospital is the largest of 14 hospitals within a BJC healthcare network at St. Louis, Missouri. And we are affiliated with Washington University School of Medicine, which is one of the top 3 schools of medicine in the country. Barnes-Jewish is ranked in the U.S. News and World Report on the honor roll. We've been ranked 10 and above for several years now, which puts another level of competitiveness on us as we work at the hospital, which forces us to look at new ways of promoting our activity, looking at new ways, new strategies for marketing our materials. And then 15 of our specialties are ranked among the best nationally. So we are a large hospital, so by the numbers you can see that we have a task ahead of us. With 9,000 more employees, how do you get the message out to everyone, especially when you're rolling things out, as you'll see, our year of IT. And then 1,700 physicians. So we are affiliated with Washington University, so we have the hospital, but we also have the Washington University faculty who need to be up to date on everything because they come over to work in our hospital. So keeping everybody abreast of all the new activities that are going on is our challenge. We have 1,200 beds, so just rolling them out to the nursing unit. That's 51 different nursing units in our hospital. And you can see by the volumes that inpatient, outpatient surgeries, as well as the ED, keeps us very active, while at the same time we're rolling out all the new technologies. So we started the GEEK process in 2009. We called it and labeled it the Year of IT. And it was at that time when we thought we had to figure out some kind of strategy. As I laid out the map for the year in the program management office, we were rolling out a lot of projects that were hitting all of our staff, from transporters all the way up to the administrative team. Everybody was trying to figure out what in the world we were doing, and we weren't going to stop. And the reason why we weren't going to stop is because we are on a path, just like every other hospital, following the HIMSS model for the HIMSS analytic EMR adoption model of where we are, where all hospitals are going. And for those of you who may not know, the meaningful use component is looking at paying hospitals if you get to a certain stage. The CPOE, for example, happens to be the first stage for the meaningful use where hospitals will get paid for the efforts that they're putting forth to get to that electronic medical record. So we've been on a path. We are at the hospital 4.5 right now, having just implemented our computerized physician order entry systems. And our year of 2010 is getting even wilder because that just laid the foundation. So the geek world is ready for Geek 2. Some IT facts just real quickly before I turn it over to Val is that roughly 70% of all of our IT projects that we've implemented across the country either come in material or phase, over budget, or fail to meet user expectations. And we witnessed that at our hospital when we were trying to roll out some of the computer applications. It was just a tough process to go through. A third of the projects were canceled before they even got completed, and over half of them were way over the budget. So we realized at BJ we had to do something. So we created what we call the Program Management Office, and that is my role, my area, that we created a new department in the hospital. And what we do is we provide oversight and sync up all of our projects. And we standardize workflows. We're always working with the end users, the nursing staff, the physician staff, all the ancillary departments. We manage any risks that might happen of why we might not get it done on time, on budget, or not meeting the expectations of the end user. And then trying to very consistently roll out projects, and at the same time controlling costs. So it was at that time that I introduced Val to my department. There's many things that we do within the PMO, which is prioritizing projects, what comes before the next one. CPOE happened to be one of those big ones, but we also did one of the pharmacy system. We had a new radiology system. We had a new operating system that went into place. We had anesthesia all lined up for all their projects. So we were doing all of that at the same time. But I found it very difficult for me to continue without a lot of help on how do we get the message out to everybody so that they stay on the same path with us. How do we make sure that they understand what's going on? Because in the literature, a lot of what the failure points were in our projects was the fact that the users' expectations were not met because we weren't really good and really clear on what these projects were all about. So in comes Val, and basically that's what we're going to talk about now is the communication piece of the PMO. And in all of our organizational structures that we have for all of our projects, we have a lot of people. This particular project was a $44 million project that I was implementing for CPOE and clinical documentation. And I added Val onto the project team as our communication expert. And that is where Val's going to come up and kind of talk about her role and how we were able to kick it off at Orange Jewish Hospital and how the Geek Chic came to be.